Good afternoon and happy Friday, everyone. For those of you that do recognize that it's Friday, we've been so busy, I know everyone, that it's hard to pick one day from another going forward here. But I want to thank everybody for joining, and I want to thank everybody who sent in questions from the last time. We'll cover some of those questions today. I'm Dr. Herman, and I have the privilege of being the Chief Executive Officer of Essentia Health. And I would like to start out by thanking every one of you out there for the great work you're doing, for the teamwork that you've come together, for the leadership that you've provided, not just here at Essentia Health, but to other organizations who have reached out to us for help. And let's all stick together and keep working through this. What we're trying to do in times like this is communication is incredibly important. And it's particularly important when we can't be face-to-face each and every day. I really miss walking down the hall, talking to my colleagues, walking over to the hospital, saying hi to the staff, dropping in and seeing how things are going. And that's something that, gives me energy. And it's an opportunity for someone to stop me in the hall and say, Dr. Herman, what's going on with this, or this is what we've heard. And I really, really miss that. So we're going to be doing these webinars twice weekly to try to bring people up to speed, in addition to the other communication devices that we're using, the daily COVID-19 update, our huddle messages every morning, and then the COVID-19 SharePoint site. I'd like everybody to take the opportunity to reach out for information when they need it. And you are a wonderful source of information for us, not just through this, but through other things where you can send in your questions and we can answer them. But we really appreciate your questions, and we'll do our best to answer each and every one of them. There's a lot of us out there that are working very hard every day. These are somewhat uncertain times. I know that sometimes information can be conflicting from one day to the next, and that's because things are changing so rapidly. Sometimes the facts change. Sometimes our understanding of the facts change, and we try to get that to you as quickly as possible so we can make sure we're doing the best work we possibly can. Our agenda today, first I'm going to have Jane Rudd talk to us about e-visits and testing and then virtual visits. There were some questions about proper mask use. Some of us may not be doing that the right way, and we're going to ask one of our colleagues to bring us up to speed on that. And then we're going to try to answer some of the questions that came in from the last one. So with that, Dr. Rudd, I will turn it over to you.
Thanks, Dr. Herman, and thanks for having me here to give a couple of updates. I'm going to start first with the e-visits and what we're doing for testing for COVID-19. So first slide, please. So as many of you know, I'm a family doc at West Duluth Clinic, but I oversee the Essentia Medical Group for Primary Care, which is roughly 400 family docs, NPs, and PAs across Essentia. And about 3 or 4 years ago, we started looking at the opportunity to offer electronic visits or e-visits to our patients, knowing that some prefer to interact with us in that manner. We started with the Epic platform, and it was really clunky and not very well received by providers or patients. So we started looking for other platforms, and the one that we settled on is called Zipnosis. It's a company out of the Twin Cities. And about 2.5 years ago, we launched a Zipnosis e-visit. Many of you might have been the first to do this. We started with our own employee population and then rapidly rolled that out to our community. It's a retail product. It costs $30 to do a visit. You don't have to be an Essentia patient. And we offer it for about 20 different illnesses. Urinary tract infections, allergies, pink eye, respiratory illnesses, influenza, that sort of thing. And it was well received. We would do approximately 40 to 60 visits on a typical weekday, 10 or 12 on a typical weekend day. Some of the limitations were that we are a big system across 3 different states. And at the time, you needed to be licensed in the state where the patient resided. So we had a small group of providers who were tri-licensed, which is clunky and cumbersome and expensive. We also would have to direct the visit to a provider who was sitting in that state. So I had to have somebody sort of quarterbacking where those visits would go. I sit on the advisory committee for quality for Zipnosis, and we were meeting in February to talk about what was working, what wasn't, and had the opportunity to talk with systems across the United States that are using the same platform. Multicare out of Seattle happened to be at that meeting. And as you know, the COVID virus hit the Seattle area early and it hit them very hard. And Multicare shared their experience with offering a free e-visit for COVID-related illness. And we brought that back to our team. Next slide, please. And in mid-March, we began offering a free e-visit specific to COVID-19. As you can see on the graph below, our volumes rapidly went up. Instead of the typical 40 to 60 per night, we started doing near 400 and a couple of times a little higher than that. It was greatly appreciated by the community. Patients could sign into our website. They did not have to be a patient, again, of Essentia. So anyone in the community could look on our website, look at the e-visit tab, and before even initiating a visit, it gives a lot of advice. It tells what the symptoms of COVID are. If they choose to initiate an e-visit, it walks through what their symptoms are and offers, again, advice and return to work, letters, those sorts of things. And next slide, please. If the patient was found to be have the criteria for needing testing, we then could send them for a COVID-19 test. Now, the guidelines around testing have changed rapidly and frequently. Early on, about a month ago, I felt like if I could make a decision that lasted more than 20 minutes, it was a good day. More recently, the guidelines have stuck for the last week or so, although we are looking at maybe being a little bit more liberal with who we test. I wanted to show here the reason that we were choosing to do the tests at a remote site instead of just coming into our clinics was to reduce our use of PPE. At a test site like this, the patient stays in their car. They're not walking through our clinics and potentially exposing other patients or our staff to the virus. The test takes very little time, can be done while they're sitting in the car, and so our staff are able to reuse PPE and simply change out gloves in between patients. So it has been a really well-received offering. We started with a test tent at our business service centers in West Duluth. Unfortunately, the weather in northern Minnesota hit hard. We had wind and snow, and the tent was not very comfortable to work in. And very thankfully, the Croix family in West Duluth offered the use of their Voyager bus barn, which is what you're seeing here. It allows our providers to be indoors. It's warm and it's been working very nicely. So we're very thankful to them. We're also offering testing in Baxter, Detroit Lakes, Fargo, Virginia, and we've connected with some community partners in Spooner, Hayward, Ashland, I Falls, and some other places. So we are able to offer this test close to home. What you'll notice is that this is not a triage site. This is a site to go if you have an order for the test already in place. Next slide, please. So again, who we're testing are only symptomatic patients. You need to have one of this COVID-19 symptoms. And then here are the other categories. You can be a resident or a staff that lives in a congregate setting. This means a 24/7 place that you live, such as a nursing home or a group home, a homeless shelter, a jail, those sorts of patients. We're also obviously testing hospitalized patients with symptoms, healthcare workers or their direct household contacts, childcare workers, first responders and their household contacts, dialysis patients, those over 65, and those with underlying comorbid conditions. Next slide, please. So that e-visit platform, again, is for specific symptomatic patients, and for COVID, it's free. For other of those 20 illnesses, it's $30, and it's limited to just that. What we quickly realized as we were beginning to need to limit people coming into our offices and needed to reach them in other ways is that we would like to offer a virtual visit that expands to more than just those 20 conditions. So thankfully, the Primary Care EMG had been working on this project since last fall. This was actually one of our strategic initiatives for the year, and we had planned to roll out a pilot, a very small pilot across 3 locations in our different markets. About now it would have launched, and it would have been a very small population of patients with depression. Once COVID came along, and I talk in terms of COVID time because it has accelerated what we do. I think a COVID day is equal to about a week in pre-COVID time, and a COVID week is about a month, and a month is about a year. And I think those of you who've been doing this work would agree with me. But in COVID time, we chose to make this really our top priority. And I have to really thank our IT colleagues who dropped everything and turned all of their energies towards the virtual visits. In a matter of days instead of weeks or months, we were able to launch this, piloted it just for a couple of days, and then went forward with all of ambulatory care and now many of our therapies as well. We have completed over 40,000 virtual visits. We started with about 5-to-1 telephonic to video, and now we're less than 2-to-1, so the majority being video visits. And this is something we need to celebrate. We are, according to Epic, one of the only ones doing this at this level. I've heard other systems get real excited that they've gotten up to 1,000 virtual visits, and we're doing that in the morning. So you should be very proud of the work that you and your teams are doing to offer this to our patients. I truly believe it has made a huge impact in terms of combining with our social distancing to reduce the spread of COVID, but we're also helping reduce that sort of second wave of problems that can arise when we don't treat our patients for their conditions. So a diabetic who went without care for a month or two, didn't have their insulin or didn't have the resources they needed to test their sugars would be really suffering by now. So again, kudos to our teams for offering these at such a high volume so quickly. Next slide, please. So the keys to the virtual visit is it's a secure Zoom platform. They need to be an Essentia patient and be active in My Health. If you haven't done this yourself, if you get on your phone, you can look up My Chart and download that app for Essentia, and it's handy right there on your phone. The advantage to the virtual visit, the video visits, is that we can document directly into Epic, and it's really treated very much like an ordinary visit. We're encouraging everyone to basically do any appointment they would have previously done in person to try it as a virtual visit first. We can always step it up to in person if it's needed. Again, we are well ahead of the state and even the country in offering this service. And although we tend to be sort of Minnesota nice and humble about things, I think this is one we need to really stand up and be proud. Next slide, please. We've been trying to get the word out. You've probably seen TV ads and heard this on the radio. We're doing social media releases. In fact, the QR code down there in the right-hand lower corner is something the patients were able to scan, and they did it at such a high level, I think we broke the system. So that's a good problem. We've been reaching them also through direct mailers, billboards, print and radio ads, etc. So again, thanks to our marketing team for supporting us in this work, and thanks to all of you for doing these visits. Next, please. Again, the difference between the e-visit, which is a retail product, $30, 20 specific symptoms that are treated, and the virtual visit, which is all comers as long as they're Essentia patients, and again, need to have My Health or My Chart loaded on their phones or their devices at home. What we've learned from this process is that we need to move quickly. The virus is coming, and it's coming at a pace that is concerning, and this forced us out of our comfort zone. It forced groups, teams that maybe had worked in silos in the past to come together and to be brave and be bold. I truly believe medicine is forever changed. I don't think that we will ever go back on doing virtual or video visits, and I don't think our patients will allow us to. They are finding the advantage of not having to get in the car and drive in to see us. We have a wide geography, and patients were having to drive sometimes an hour or two to get to their doctor for a quick checkup that they can do now in the comfort of their own home. So thank you everyone for being bold and being brave and continuing to try something that we had never done before. It's working, and I think our patients are the better for it. So thank you.
Well, thank you, Jane, and thanks to your team. a very broad team and a lot of people across all of Essentia that have worked very, very hard and are delivering this every day. I had an opportunity to have a phone call with the Secretary of Health and Human Services this morning talking about what we're doing here. And I told him that my strategy for 2021 is burning the ships. We cannot go back to healthcare the way we did it before. There are some concerns, I will have to say, at the Health and Human Services among a small group of people that say, oh, you know, if people do this, they'll just do a bunch of that and they won't do the other stuff. We're going to be working together with Health and Human Services to make sure that we can continue to do this going forward. And he did warn me that he was going to be using the term burning the ships, and I might hear that again, and I might hear that attributed to Essentia Health, and I said that's just fine. Our patients want this, our patients need this. The opportunity for us to more easily touch our patients and more easily engage with them to keep them healthy is an incredible opportunity, and we can't afford to go back and miss this opportunity. What I'd like to do now is talk about proper mask use, and we've asked Kari Russell, our infection prevention manager. I solicited questions the last time we did this earlier this week, and some of the questions we got or statements that we got is, I see my colleagues not using their masks appropriately. Could we please take some time to make sure we're all on the same page of the playbook to do that? So Kari, I'll turn it over to you, and thanks for joining us today.
All right, thank you so much, Dr. Herman. If you could advance to the next slide, please. All right, so as Dr. Herman mentioned, we did get some questions after the last video update specific to masks and personal protective equipment, or PPE. And we wanted to address these questions, keeping in mind that we're moving to a scenario where we're asking every colleague to mask at all times when they're in our facilities. And that's not a usual process for a lot of our colleagues. It's very much the norm for those people that work in direct patient-facing roles, but is not really the norm for people who routinely don't have patient-facing roles and doing direct patient care. So a couple of the questions that we got were, would you please address appropriate use of masks by staff? I see people walking through the hallways with masks under their chins, on top of head covers, or not wearing masks at all. And what are the proper protocols to keep in mind when wearing a mask? So we're going to try to address those questions today. If you could advance to the next slide, please. So we have three main types of masks. We have the N95 mask or respirator, and we're using that for the care of critically ill, known, or suspect COVID-19 patients, and also using that style of mask during aerosol generating procedures. We also have a surgical mask or procedure mask, and those are being used by our staff and colleagues in direct patient-facing patient care roles, also in the care of a non-critically ill, known, or suspect COVID patient. And then we have the cloth masks or the homemade masks, and those are being used by staff in non-patient care roles and also by patients and visitors while they're in our facilities. Next slide, please. We're asking everybody to wear a mask continuously while at work and really only replace if visibly damaged or soiled. If you are storing your mask that you're going to be wearing at work up on your work unit, we would ask whenever possible for you to wear a cloth mask or bring a cloth mask from home that you can wear from the time that you enter the facility until you make your way up to your unit. If you are receiving your mask at one of the screening stations, we would ask that you put that mask on as soon as you receive that mask and wear it continuously throughout the day. Next slide, please. Some of the things that we don't want to see while you're wearing a mask is we don't want to see the mask hanging around the neck, under the nose, on the elbow, hanging on a doorknob, on the top of the head. Really, the mask should be on for the most part during the day. If you're don't have the mask on, it needs to be completely off, not just dangling around the neck like you see in the picture there. It's also really important that you make every effort not to touch the mask while it's on your face. That front portion of the mask could be considered potentially contaminated. We don't want you touching the front of your mask, then touching other things, possibly spreading germs from one place to the other. If you do inadvertently touch your mask or need to adjust your mask while you're wearing it, would just ask that you do hand hygiene then after you touch your mask. Next slide, please. So when you do need to remove your mask during the day, we would just ask that you do hand washing, and then you want to slowly and carefully take the mask off using the ear loops or straps only. Remember, we're considering that front part of the mask to be potentially contaminated. You want to visually inspect it to see if there's any soiling or damage and discard only if necessary. And then if you need to remove it for a break, you could place that mask in a clean single-use paper bag or the external side down on a clean single-use paper towel, and then perform hand hygiene after you've removed that mask. We do have a process for some of our staff that are using N95s for patient care to be able to remove and put back on and store the masks using a plastic container method. And we have some standard work I would direct you to out on the COVID-19 tile if you have interest in that process. And the other thing that I just want to mention with regard to the masking is we don't want to forget about social distancing. So as much as it's feasible during your workday while you have the mask on, we want you to try to be maintaining that distance of 6 feet from colleagues. But it's especially important when you're taking your mask off to eat or drink. You know, you really want to be careful about social distancing while you don't have your mask on. So next slide, please. So then when you're ready to put your mask back on, we want you to again do hand hygiene, and then you want to carefully pick that mask up, touching only those ear loops or straps, put it back on your face using only the straps or ear loops. We want you to then discard that paper bag or paper towel if that was used and perform hand hygiene again. We really want to stress that the paper bag or paper towel that you're using for storage is really intended to be just single use. We don't want you to be reusing the same bag or paper towel throughout. And as you can see, there's a theme here with hand hygiene. Just hand hygiene, hand hygiene, hand hygiene. You really can't do it enough. So next slide, please. So our goal is to have everyone in our facilities to be wearing the appropriate masks no later than May 1st. This includes all of our staff, patients, and visitors. In order to accomplish this, we're asking and encouraging patients and visitors to bring their own cloth masks from home when they come to our facilities. We continue to encourage mask donations. We've had just very generous community donations. We've got a lot of terrific sewers out there that have just sewed an incredible number of masks, but we do continue to have a need for those. So if you are a sewer or know somebody who can sew masks, we do still have a need for those cloth masks. And then it's just very important that we're continuing to conserve and reuse. These are just really unusual times, and it's just so important for us to continue to have the supplies to be able to safely care for patients as we move through this COVID-19 pandemic, that we're conserving and reusing the PPE supplies that we do have. So those that are wearing surgical masks will be rotating through a supply of 3 to 5 masks, reusing them. We just would want them to sit in a storage bag or container of some sort for a minimum of 72 hours before reusing. And then those staff that are wearing the N95 masks, we're using that UV disinfection process using our Xenex machines to be able to disinfect and reuse those N95 masks. Thank you.
Kari, thank you so much. Although we were asking for donations of masks, I want to repeat what Brian Zuck said the last time we got together earlier this week, is we're doing everything we can and every source we can possibly contact to get more masks, both cloth, N95s, and surgical masks. But we're competing with everyone else in the country. So one of the most stressful parts of our day is, where are we on our masks? What's coming? We know that we are working to get more masks from the Strategic National Stockpile, which has been depleted of masks, and they're working to get it. And then working with our colleagues at the Minnesota Hospital Association, the Minnesota Department of Health, and the Governor's Office to do everything we can to get the amount of PPE that we need to keep everyone safe and protected. Right now, as I think Brian told us, that we are getting historic levels of masks, meaning we're getting the number of masks that we would have used last year at this time, when we all know that our use of those masks has gone way up. So please help us conserve the mask. Please help us keep each other and ourselves safe as we work through this. In the small amount of time I have left here, what I'd like to do is try to answer some of the questions we had from colleagues, and then also tee up some of the questions that we'll be answering the next time. One of the questions is, to what extent has the push towards telehealth and e-visits mitigated the revenue loss incurred by the drop in patient volumes? That's a great question. And first I'll start out with, number one, every little bit helps. I think you saw the last time we got together that our revenues are down about 40%, about $75 million a month. A day's worth of work here at Essentia Health is somewhere between $5.5 and $6 million. Our current levels of telehealth and e-visits account for about $300,000 of revenue a day. So it does help, but it's only about 5% of the revenue we would normally get, and still, unfortunately, a small amount of the revenue that we would need to close that gap. Let's keep doing it. Let's keep moving forward. We're not going to go back. And that's part of this next question. I was wondering if virtual visits will be the new normal. Going forward, are we not going to do visits in the clinics unless needed to be seen? That's absolutely correct. We have found that our patients like this better. Having the geographic footprint that we have and the demographics that many of our patients are older, this is hitting a sweet spot for our patients right now. You will likely be hearing that we're going to be redesigning some of our outpatient clinics, some of them to become testing site only. That helps us preserve PPE and helps us direct the patients to a particular site and get them in and out quickly. Also, is it becoming the new normal to work from home? And the answer to that is yes. There are difficulties with that, as I mentioned earlier. I miss my colleagues, I miss not seeing them, but we need to develop a cadence where we work a lot from home and then we come to work and get together maybe once or twice, 2 days a week, and reconnect with each other. That will likely require some changes in our office space, some changes in the way we work together. I'll be really frank with you. I was not excited to come and work from home. I enjoy my home, but I miss the people there. But I do see advantage of this, and this will become the new normal. I think this will be wonderful for people who have a part-time, people who have to travel a long distance. I think this will make people's lives better, make us more efficient and more effective, and certainly with the video visits and telehealth visits, more effective for our patients as well. On Tuesday's update, some of the questions we've got, people said we've been hearing a lot about the modeling that's going forward that allows us to anticipate what the surge is going to look like with this pandemic. And so I've invited Dr. Sarah Manny and the Enterprise Analytics team to come and talk with us on Tuesday afternoon, April 21st at 4:30 to go through the predictive modeling. Normally we plan about 30 minutes for these meetings. This will go a little bit longer, probably 45 minutes, but it will give the team an opportunity to show you how this works, to show you the assumptions that go into it and how the model has been changing over time. And to really, this is a wonderful model that really demonstrates the impact that social distancing has had on probably flattening the curve, but most certainly pushing the curve down the road that allows us, that surge down the road that allows us to be better prepared for it. So I hope that you can join us at that time. We will just do that, probably won't have time to answer other questions, but please do continue to send in questions. Next Friday, we'll do more PPE questions. What measures are being taken to ensure adequate dose of UVGI is being delivered during each treatment of our N95 masks? And then another question, should shoe and especially head covers be recommended for staff providing care to known or suspected COVID-19 affected patients? So we'll be answering those questions, and perhaps if we have time for others and we get others from this, we will do that next Friday at this time. So again, a reminder, please email your questions to liveupdatequestions@essentiahealth.org. And we look forward to seeing you again next Tuesday at 4:30, where again, we will review modeling. Again, I want to thank everybody for the hard work that you're doing. This is an incredibly stressful time. We feel it. We can see it in each other's faces when we have our masks off. We can see it in each other's eyes. Please thank your families for me and the rest of the leadership team. We know that as much as we would like to leave the stress at work, sometimes it does come home with us. So please reach out and thank your family. And social distancing does not have to occur within the home. Give them a hug for us as well. So again, thank you very much. Have a good and restful weekend for those of you that have the weekend off. Thank you to those who will be taking care of our patients over the weekend. And we look forward to seeing you again next Tuesday at 4:30. Again, thank you very, very much.